Hello and welcome. We are the Quality Improvement Academy here at Walsall Healthcare, and we are here to support you in developing your understanding of quality improvement and, importantly, how to apply it. So during this session, what we're going to do is we're going to look at what actually is quality improvement. We're going to identify some of the key QI tools that we would recommend for you to use during your project. We'll give you a bit of an introduction into the QI Academy. We'll then talk about how we can help you and that offer to you as you go through your training, and also some additional QI support that is there for you. So, what is quality improvement? Well, importantly, quality improvement is not actually the same as improving quality. According to this CQC brief guide, which is where you can assess yourself against quality improvement metrics, quality improvement is the use of systematic methods to involve those closest to the quality issue in discovering solutions to complex problems. It applies a consistent method and tools, engages people more deeply in identifying and testing ideas, and uses measurements to see if the changes have led to an improvement. So within the Quality Improvement Academy, there are 3 tools that we are going to pick out from what is actually a list of hundreds of quality improvement tools and frameworks at your disposal. And these are a great place to start. So the ones that we're going to look at today are the Model for Improvement, Measurement for Improvement, and the Sustainability Model. So first up is the Model for Improvement. Now, it was developed by Langley Nolan in 2009, and the reason that we would like to signpost you to this model is because of its simplicity. It is made up of 3 questions and then a way of testing your change ideas, which is through a PDSA cycle, or Plan, Do, Study, Act. So, as I said, it's a simple tool based on 3 questions. The first one: what are we trying to accomplish? Or what is your improvement aim? What is it you are trying to achieve? Secondly, how will you know that your change has actually made an improvement? And this is all around what are the measures that you going to use for your project. Then we want to think about what changes can we make that will result in the improvement that we seek. So coming up with some change ideas that we are going to test one at a time. And then lastly, that way of testing change is all through the PDSA cycle, or Plan, Do, Study and Act. So thinking about the model for improvement in that very first question around what is it we are trying to accomplish, also recommend to you that you utilize this SMART acronym. So when thinking about writing your improvement aim, which does take some time, really focus on, is it specific? Have we been specific about what exactly it is we are trying to improve? Is it measurable? Is there a target within your aim? Really, really important. So somebody reading your aim knows exactly what it is you're trying to achieve. Is it achievable? We want your aims to be ambitious, but it needs to be something that is achievable. Is it relevant? So can we link your improvement aim to the strategic aims of the organisation? And is it time bound? So have you included a time frame for your project? It's really important, even at the start out of your project, you're thinking about, actually, I've set myself a target, a measurable numeric target. We think it's achievable, and this is when we are going to achieve it by. Now remember that your aim is iterative. It may change over time, but this is an acronym that I think will hold you in good stead when you are writing your aim. And also remember that when you're creating that aim, create it with those that are going to be working with you on your project. It's not something that you should do in isolation. Measurement for improvement. How will we know if our change is an improvement? Now, often we see people displaying data in terms of RAG tables, like you're seeing on this slide here. For most people, it's really difficult to pull out whether, from the data that's presented here, whether the changes have resulted in improvement or not. Boxes coloured in different colours, really hard for us to say whether the change has made a difference over. And the important thing is, has it made a difference over time? So even pulling this data out, looking at mandatory training compliance, there's lots of amber there. There's lots of colours, it's hard to see the numbers. I don't know whether we're demonstrating any improvement whatsoever. What we would recommend for you and for your improvement projects is actually we start looking at data and plotting it over time. By that I mean, in this example, we're plotting monthly data over a period of time, and actually it's really quite easy to interpret the data and see that actually over time we're seeing an improvement, we're seeing an increase in our compliance to mandatory training. This is actually something called a statistical process control chart. You could also use a run chart. What we're trying to encourage you to do is, rather than looking at data at 2 points of time, we've done an audit, we have collected some data, we've made a change, and then we're going to re-audit in 3 months. What we're suggesting is actually want to pick a metric, pick some data that we're going to be able to plot over time to see if there is a gradual change in the data output. So over time, introduce a change. Has it made a difference? Yes, it's getting better. Fantastic. It's getting worse. Okay, we can stop and we can try another test of change. But that emphasis on looking at the data as it comes in and working through it over time. So this is just to reiterate then that often improvement or worsening performance can actually be hidden within a RAG table. Best way of looking at data to see whether our change has resulted in an improvement is to look at your data and plot it over time. The last tool that we're just going to very quickly talk about is something called the sustainability model. So it was designed to be used within the NHS, and it's designed specifically to work around improvement project. It is not designed to assess whether a department, organisation or other healthcare community is likely to be sustainable. Okay, so this is very much around your project. So the goal was, as I said, to develop a tool that was easy to use for NHS teams. It allows us to identify and understand the barriers to sustainability for your specific situation. So this is absolutely relevant to your projects. To know what they can do to overcome those barriers and to monitor progress towards sustainability over time. This is all about making sure that at the end of your project, the changes that you've made result in a sustainable improvement. So in other words, we're not going to go back to the way we did things before. So really thinking about the sustainability of your improvement changes. And that just emphasizes again the fact that this is about using the tool against a project rather than against a department or organization. So what is the sustainability model? It is a really simple multiple choice questionnaire which you complete by yourself, or better still as part of a project team. You should complete this survey at the start of your project, at the middle of your project, and also at the end. All you're doing is you're going through 3 domains, 10 factors, which means there's going to be 10 questions. This tool will give you a score and it will identify areas where you need to work on. Now, the way that the tool works, it presents it in 2 different formats. It can present it to you in a portal diagram, or it can present it to you in a bar chart. So we're looking at staff, process and organizational factors. When you're working through the multiple choice questionnaire, what it will also do, it will identify those that are scoring low, but based on the question, it actually gives you insight into what you need to do to increase your score. It's a really intuitive tool. It's a tool that is simple to use. It is quick to complete. And again, it will identify those areas that you need to work on to ensure that your project and the changes that you implement are sustainable over a longer period of time. So the Walsall Healthcare QI Academy, what are we? We are made up of a head of quality improvement, a QI program lead. We have a trust clinical lead for QI who is a medic. We have 4 divisional leads for QI, so one across each of the 4 divisions within the organisation. Also, to support these roles, there is a MDT, Quality Improvement Leadership Team, that oversees the strategic direction of the Quality Improvement Academy. Now for you, we do offer quality improvement training. We provide a 1-day quality service improvement and redesign fundamentals, which is an introductory session. We do a more in-depth 5-day QSA practitioner program. All of these courses are available to all staff across the organisation. We also deliver CUSA Virtual, which is 8 one-hour online modules that you have to sign into all 8 modules to receive your certification. We can also provide bespoke local training. We can offer you project support and also project coaching. So if you want to get in touch, you want to find out more information, we're available via email, so qifaculty@walsallhealthcare.nhs.uk. You can follow us on Twitter. Here is a link to the web pages where we keep all of our QI information, resources, project lists, etc. Also, each week we run a virtual quality improvement cafe or QI cafe using Microsoft Teams, and that link is shared separately. So welcome to Walsall. We wish you all the best. Good luck with your quality improvement projects, and if you do need any support, please do get in touch. Thank you.